Hello and welcome to the latest episode of the Melbourne Athletic Development Podcast. Today, we are very lucky to be joined by Dr. Tim Gabbett. Tim, can you give us a little bit of a background about who you are and what you do?
Thanks, John. Thanks, Jack. I'm a sports scientist. I've been involved with sport my whole life, but worked in sports science as a career from a pretty young age. So I work mostly with elite level athletes, professional sports, but in recent times that's kind of expanded a little bit to include um, athletes who aren't quite elite but have an elite mindset. So that's a bit of a background. I work mostly, I work all around the world, but predominantly with team sports and dabble a bit with individual sports as well.
Fantastic. Your work has become very popular, I think, across a number of different fields, especially in sports performance, but particularly in injury. And obviously, I'm sure Jack has given you some background that our involvement crosses over both, but we're initially trained as physios and work across sports performance as well. Can you give us a bit of an idea about how that research started to develop? Because one of the interesting and good things I think that came from that was that it seemed very practical and you were using it in sport. Like, I think, correct me if I'm wrong, but it came from your work when you were working in rugby, and you started to develop some understanding more recently. What I'm talking about for people who aren't aware is this idea of acute to chronic workload ratios and what effect they have on performance and or injury.
Yeah, well, I mean, in terms of, I wasn't sure which research you were talking about because, the
Yeah, you've got lots.
well, there was a bit of research before that, like so. I feel like there was a lot of cool stuff that got done well before that. It's just for whatever reason that one resonated
Well,
with
maybe
people
tell
more
us
than
about that then.
the earlier stuff.
Maybe tell us a little bit about that. Yeah. So for people who aren't aware, because obviously you have become synonymous with this whole area of research, but I know that you've been involved for a very long time in sports performance.
Yeah, well, look, I mean, I've sort of looked at a whole heap of different areas of research. When I first started out, my early research wasn't in sport at all, and that wasn't by choice. It was just um, in those days when you enrolled in a higher research high degree, it was pretty much you were told what you were going to research. Um, so I was involved in blood pressure control, cardiovascular responses in older individuals, like 65 to 75-year-old individuals. So there was a training component to it, endurance training component to it, but it wasn't sport related. So a lot, parallel to that, while I was doing that research, and that was my PhD, I was working in sport. I'd always worked in sport, so and there was just a whole heap of questions that coaches would come to me with, and we would basically be trying to answer questions for the coaches. So we'd be collecting some information along the way. We'd go away, analyse the information, and by the next session we'd come back and we'd have a bit of an answer for the coaches. So it became,
Mm.
to me, research was never about test tubes and lab coats. It was just, and it was never really an academic pursuit as such. Like, it wasn't something that I set out to write a heap of papers, or I wanted to be. I never ever wanted to work in an academic institution. It was just coaches had some questions, athletes and players had some questions. So it was kind of like, okay, well, it's a good question. I don't know the answer. Let's see if I can design something in training, or look at some things that we're doing in training and see if I can come back with an answer for you. So, that research was all around how do we score points on the opposition? How do we train as hard as we possibly can and maximise the positive and minimise the negative? when we're training, if specificity is important, what do those demands look like? So there was those kind of questions came a long time before the research around the acute chronic ratio. That was probably, I don't know, I'd be guessing maybe 20 years before that stuff.
Yeah.
20 years before the acute chronic ratio.
Sorry, we're just having some technical issues, I think, with our internet.
All right.
You sorted that, Jack?
Let's see.
Sorry,
Can you hear us okay, Tim?
Yeah, you just dropped out on me there, guys.
No, I think we're back on. Can you hear us okay now?
Yeah, I got you again.
All right, good. Well, with that in mind, Tim, how did your research start with looking into the acute to chronic workload ratio? Was it a similar story where there was a real world problem that coaches were coming to you and saying, look, we're interested to see whether there is a particular pattern that we may see, clinically already that we'd like to look at from a research perspective?
Yeah, well, I mean, they would never have used the word research, but absolutely, yeah, they would have come to us and said, how hard can we train? I want to train hard, but I don't want to break them. So how much load can we give them? And then the next question would probably be, okay, well, we've got a better understanding of that. How much can I change training load from week to week? Now the problem with both of those is that we're talking about absolute load in one question. How much can you handle in 1 week? And then the second question is, how much change as a percentage or an absolute load can you handle from week to week? And what we were noticing, and this was the real world aspect of it, and how the textbook doesn't always apply. The textbook, if you picked up a textbook and read, why overuse injuries occur, the typical answer is that it's due to high training loads, excessive training loads. But we were finding that our players with the highest training loads had the lowest injury rates. And typically we were finding players who were coming out of rehab, they were the ones that a few weeks later were back in rehab, right? And then
yeah,
going, hang on, the textbook says this, but we're seeing this. Why is that the case? And then it kind of was a light bulb moment. It wasn't as though there wasn't any other work out there on this. Andy Coggan had done some great work with Training Peaks, looking at it from a performance aspect, and he calls it training stress balance. But it's the exact same concept. Basically, we were when our players were coming out of rehab back into peak performance or back into main training, we were asking them to do much more than what they'd been prepared for. Right, so it wasn't that high loads were the problem. It was just that they'd come from such a low base, and then that kind of stimulated this idea of really the question relates to not so much is this too high a load. The question is this load too high relative to where you've come from or relative to what you've been. And that's where the concepts of acute and chronic loads came in. Now, I've had conversations with my dad about this, who'd been training athletes, when I was a kid, and he'd been involved with training athletes for a long, long time. And when I explained the concept to him, he said, "Well, that's common sense, isn't it?" So.
Yeah.
He knew all this stuff long before scientists had developed words to describe, fancy words to describe it. So his common joke to me was, "Great, I'll tell people Tim's talking about shit we already know." So yeah, but it's been around a long time, this concept of loading relative to capacity.
It's an interesting point you make, Tim, and we've had this discussion with other researchers before where, like, what is the role of research? And, you've sort of said it's similar to what we've heard from other people say, that research often is finding data that supports what coaches have been doing for a long time already.
Mm.
Do you think that's the role of research, or do you see that it can be the other way around, where research does actually inform what we should do in the performance or rehabilitation setting? Because I feel like there has been a bit of a rotation now where so much of researchers and what they find dictates what we should do, particularly in our
In
field in
practice, yeah.
rehabilitation, as opposed to the other way around of, the coaches or the clinicians being the one like, these are the things that we're doing. Can you have a look at this from a research perspective?
Yeah, well, look, I'll give you a couple of examples. Well, firstly, a few years back, I worked with a team that Wayne Bennett was the coach of, and I remember having a conversation with him about it. He said, what you've got to realise is that the stuff that scientists are proving, we've been doing for a while. Coaches have been doing this stuff for a while, and I love the conversations with him because he's an intelligent guy. He's quick to downplay the importance of science, but he uses it every day. And he wouldn't call it science, but the stuff he does is, we now know is there's evidence behind it. Now, what came first, whether he invented it back in the 20s when he started coaching, or I mean 20-year-old, not the 1920s.
I thought you were alluding to how old Wayne is.
But it's probably,
he's old now.
It's probably around the same period. But they kind of, whether researchers have seen what's going on in coaching, and then they've tried to study it, or the other way around. Sometimes I actually think practice drives research, and I actually think the good practitioners are driving good research questions. Now, the second part of this answer is, I don't see research and practice, or research and clinical practice being at two polar ends of the spectrum. I think some people see that, but I see it as a cycle, right? It's a research practice cycle or continuum where, in practice, if you're just treating someone and you're not thinking, there's no conceptual involvement around what's happening in this person's body. Why are they experiencing pain when there's no tissue damage? If there's no kind of critical thinking, then that's just a service provision. You're providing a service of some sort. But as soon as you have some conceptual involvement in that process, as soon as you start asking a question, what's driving this pain? What's going to be the best way to get this athlete better, this patient better? And as soon as you try and find an answer to it, as soon as you ask a colleague, as soon as you start digging into papers, as soon as you start doing your own little investigations to find out, that's a type of research. It doesn't have to be published to be research. Now, the whole idea of the research practice cycle is the good questions come from practitioners, and if you've got some good researchers around you, they can put some projects in place to try and answer that question, which then cycles back to the practitioner so that you can provide a better level of support, which then drives further questions. You do more research, and that's how we all get better. Then the final part of this is that if you're relying on research publications alone to inform your practice, and you're calling it evidence-based practice, then you're doing your patients and your athletes a disservice, because it's only part of the evidence-based practice model. When we look at the evidence-based practice model, it involves research. Yes, you want to use the best available research, but the research is going to be old, right? It's, by the time it gets published, it could be 2 years, 5 years old. You've got to think of your clinical experience. So, and you've also got to think of your athletes' values and beliefs and expectations. It's when you use those three things together, that's when you're using evidence-based practice. You just don't want to rely on too heavily on one or the other. You want to try and bring all three into your model if you can, and into your clinical practice if you can.
Yeah, and that's something that John and I talk about all the time. We probably sound like a broken record where you definitely see it in our profession where evidence-based practice, the term has been hijacked by research only. And you see a lot of limitations with that because just as you mentioned, there is so much complexity to understanding why someone develops an injury in the first place. And this very kind of linear approach people take of like, oh, here's a diagnosis, therefore we need to do A, B, and C. You just see it coming up with limitations time and again in terms of how good the outcome that patient has following an injury if you're just applying the same, cookie cut method. The other question I had for you, Tim, then is, look, you clearly approach your research with having a lot of experience in the field. And that's where, the acute to chronic workload ratio research came from. But that research also has come, it seems, with a lot of criticism. Like, I've certainly come across, other researchers who are quick to criticize the research that you've done. Why is that? Is this more of just getting too much into
the weeds
and looking at the statistics and limitations of research that you do, or it seems to me a bit mind-boggling because it seems to me when you look at your research, it does make very good practical sense.
Well, look, I think there could be any number of explanations for it, and I think that part of it will probably come back to the people that are most vocal and most critical. And it probably speaks more about their insecurities than the research itself. But let's talk about that research. The first paper that we published on that is 2014, right? And it's now 2024, and we're constantly talking. You and I even are still talking about that paper, right? And that model. Now, as soon as that paper was published, even before that paper was published, we're moving on to the next thing, right? So where it might become novel for people in 2015, 2016, 2017, we're already thinking about the next project. So 10 years down the track, or even 5 years down the track, when the critics have finally caught up, I'm kind of laughing because I've the things that they're bringing up, we thought about 5 years earlier, and we've already moved on to the next research question and answered those questions, right? So we're not back in 2014 anymore. We've moved on to the next project. So a lot of the criticism just puts me to sleep. I have a chuckle and it puts me to sleep because these academics have tied themselves in a knot over research questions, like they've discovered something that we're unaware of. Every project has limitations, and we've addressed the limitations multiple times. So until I don't feel a need to address them anymore because it's just like it's in so many different publications that I've acknowledged them. Every model will have limitations. There's going to be some practical parts. There's going to be some useful parts, and there's going to be some parts that you go, oh, look, this is where the model breaks. All right, this is where we've got some challenges here. What do we need to do? So, research doesn't sit still. What we knew yesterday will change tomorrow, just when a new research project comes out, a new paper comes out. So, where we were in 2014 and what we thought about training load, it evolves, and as new papers come out, our thinking should evolve as well. So, what I thought back in 2014 is probably a lot different from where I am now. I probably think statistically, that's probably where a lot of the debate goes, a lot of the criticism goes. And to be honest with you, the people that it's a long way away from what I do day to day in high performance sport. I can guarantee you that no one I'm talking to who is working with athletes on a day to day basis is talking about coupled or uncoupled ratios. That we're talking about the weekly plan. What does our week look like? We're looking at session plans where we're looking at whether we achieved what we wanted to achieve. And when we deliver a session, we're looking to win that session. We're not thinking what is the acute chronic ratio today. It's a progression in training is one piece of the puzzle. But it's not the entire jigsaw. And if there's a few ways we can improve capacity. We can do it through progressive overload, and this is where the acute chronic ratio comes in. But I've heard of other people who hold load constant and they pull the health lever.
Mm.
Right? So they try and maximize sleep. They don't change load from week to week. They just try and maximize sleep, minimize stress, maximize hydration, nutrition, get your soft tissue work done, and that's how they achieve improvements in capacity. So there's different ways of going about achieving your performance goals. Absolutely. And if you use it or you don't use it is kind of irrelevant to me, because there's just so many other aspects that I would look at within a training program. Many times I'll go and work with teams. It's just not something that we discuss, because we're talking about bigger issues.
Well, it sounds like what your research really reinforces is the importance of planning and programming from an injury perspective as well, too, that you actually have to have some structure to what you're doing with athletes and how you progressively overload someone, and obviously keeping that within certain parameters to make sure that you're not making big jumps and how much stress you're actually applying to the system.
Yeah, essentially, we know that injury risk increases. We know that in order to get better, you want to load a little bit more than your capacity, and your capacity will improve. Now, the challenge there is that if you have massive increases in load relative to capacity, that increases your risk of injury. So this is where the challenge lies. We want to load just enough, more than our capacity to get better, but not so much that we break the athlete. But in terms,
and how do you go about doing that? How do you go about doing that, Tim? Because I think this is where it gets interesting to think about the individual athlete, because obviously we see lots of variability in how one person compared to another responds to stresses, whether it be a training stress or even like a lifestyle stressor, psycho-emotional stressor. Do you start to then think about how you profile individual athletes based on, that might be based on like their muscle fiber typology, obviously based on their training history, based on other things that are going on in their life? How do you sort of go about quantifying that and thinking about it in a real world perspective?
So if we're thinking in terms of acute chronic ratio now, where we were in 2014 as the first paper, now we've moved to 2017, right? So the conversation is research, and one of the things we noticed there was that spikes in load increase injury risk, right? And people see the graph, they see the green and the red graph, and they go, okay, well, I don't want to go over 1.5. But if you look at the graph closely, when you go over 1.5, you could be at a ratio of 2, and you're still on average only 20% chance of getting injured, right? So before you rush to the coach and say, coach, we need to shut these athletes down because we spike loads, you need to think twice before saying nothing, because if they're 20% chance of getting injured, it means they're 80% chance they won't. Yes, injury risk has gone up, but risk doesn't equal rate. It doesn't mean that they're definitely going to break. So then the question becomes, well, what is it about some athletes that spikes and loads are a problem, and other athletes it's not? And that's where we talk about moderators. the load injury relationship. Now you've called it phenotype. And, essentially we're talking about the same thing. There's going to be a whole heap of moderators. Some of them we know about, some of them we've got evidence for, and they come from high intensity intermittent team sports. But I would say they're probably going to be sport specific. They're probably going to be position specific within the same sport, and they're probably going to be individual specific within the same position. So a moderator for me might be completely different from a moderator for you, even if we play the same sport and the same position. And the moderators that we know about are lower body strength, aerobic fitness, age, training history, and injury history. Like, there's 5 that we know about. So when we start to then manage players on an individual basis, we don't just go, oh, well, he's hit an acute chronic ratio of 2, we need to shut him down. What we do now is we look at those moderators, and athlete A might have 5 moderators working against him. So he's either young or really old. He's got a long injury history, and therefore he's got a poor training history, and therefore he's weak and he's relatively unfit. When you spike that athlete's loads, or when you're progressing them from rehab, then there's five things that you might use in your decision making to decide whether they can handle that spike in load, or whether they can ramp out of rehab a little quicker or slower. Now, if you have 5 moderators working in your favour, so they're in the middle of their career, they're strong, they're fit, they're training regularly, they haven't had injuries. Now what you've got is 2 athletes that look like this. One with all the moderators working against him, the other one with all the moderators working for him. And the only thing similar between these 2 athletes is the acute chronic ratio. Then, of course, you've got 2 very different athletes in front of you. You have to manage those athletes differently. This one might take a slower approach to rehab. We need to be a little bit cautious bringing them out of rehab. And if we spike their load, we might be looking at increasing recovery for that athlete. This athlete, we might be a little bit more aggressive with our rehab, or if we spike their loads in a double overtime game, it might be as simple as when they come into work on Monday, we wrap our arm around them, give them a little hug and say, geez, you're doing well, keep it going. So there's, we're starting to, on a group level, we're starting to manage our athletes on an individual basis.
Can I ask, Tim, do you differentiate, and if so, how do you differentiate changes in those loads depending on the intensity of the training load that you're applying? So obviously for someone who, for instance, is in a team sport, there's multiple capacities that they need to be exposed to. Whereas if you're doing, say, some sort of speed power sport, most of the activity that you're going to be doing is going to be highly intense. And do you have to differentiate, and if so, as I said, how do you do that between, what would be considered, a moderate level of overall intensity, even though the volume of it's increasing, versus something that's highly intense? Or at the other end, say like a distance runner where it's all relatively lower intensity for them, but their volume will continue to grow because they need to get in that volume for their aerobic development or whatever reason.
Yeah, look, even if we look at any of those team sports, individual power sports, or even our endurance runner example, typically what the programs look like are a lot of lower intensity work separated by smaller amounts of high intensity work. And what I try and do is I use in general, not for all athletes, but so some athletes will just benefit from microdosing. But in general, what I would use for the athlete who has a good training history is a polarized approach to training. And essentially what that means is we want to try and stretch the range of our athletes. So we want to be very disciplined around our low days, keep our low days low so that we can make our high days higher. So what that means is with adequate recovery in between, I might do a high day on Tuesday, which will involve some high intensity running, for example. Let's use our runner as an example. We might do a Tuesday, Friday high day or high stress day, and everything else in that program is low stress. Every other running activity is low stress. I would build in lifting in there, which will involve some heavy lifting for few reps. But essentially for a runner, that's what it would look like. Tuesday would be a high day. We have 72 hours recovery, and then we go back and do another high day on Friday. For a team sport athlete, let's take American football or AFL, you might play Wednesday, Sunday, then Sunday to Sunday. So Wednesday would be your main training day, for example. You want to allow 72 hours in and out of the match. So if you play on Sunday, you go Monday, Tuesday, Wednesday is the earliest you want to go back and do a heavier day, and you want to allow enough time.
Can I ask what? Sorry to interrupt you. Can I ask what would seem like a really dumb question? Why do you need to do that? What is the mechanism or basis for that? Like what is, because I'm not disagreeing with you, but I'm asking someone who I know knows a lot more than I do. Why do we do that? Why do we put those bigger recovery periods in between those higher intensity activities? What do you think about it? Because there's follow-up questions to this, but I'll let you answer it. Why do you think we do that, and what actual value does that have?
Well, firstly, the reasons we do it, the reasons we have those high days during the week is I want to make sure that my athlete's been exposed to what they need to do on game day, right? I don't want to send my players into game day or competition underprepared. So in general, I have a philosophy of train hard to fight easy. I want to make my training that little bit harder than competition.
Yes.
Now, your question is, why do we allow those days in between? Essentially, the way I would answer that is training. Training is your stimulus, but the recovery is where you get your adaptation, right? And you will hear all the time different athletes from different sports. I never have an easy day. I train hard all the time. Well, what actually happens there is when you want to train hard all the time and you're not disciplined around the recovery days, the low days, you're not respectful of the recovery day, what that does is drags that low day up, right? It drags it up because you're trying to train hard on a low day. But by doing that, what that does is drags your high day down. So you end up with a whole heap of training in this middle zone. It's, I'd call it junk training. You want to spend a bit of time there, but you don't want to spend all your training there, because what that means is you're not training hard enough to meet the demands of competition, and you're not recovering enough to get the training adaptation. Now, in terms of the time frame, that depends. What we're talking about now is load response. What is an appropriate response to load? Well, that depends on the load that you apply. Not all load is created equally. It differs by system and it differs by tissue. So the type of recovery that you will allow for tendon is going to be different from joint. It's going to be different from muscle, and it's going to be different between low stress and high stress systems. And that's part of the reason. That's one of the main reasons why we have a training plan. We have a weekly plan where we have some high and low days, and we map out the plan at the start of the week or the start of the month. This is what our weekly plan is going to look like, so that we're building recovery.
Can I ask, are these... Sorry, I keep interrupting you. I don't mean to. I just think of so many questions as you say these things. Are these, because I'm a track coach myself, so I've always wrestled with these ideas, which are these immutable laws of biology, or are these things that we've created in our own minds because we haven't taken the time to necessarily build up someone's capability to deal with, say, back-to-back days of high intensity stress over a long enough period? have we always just accepted that, oh yeah, I see a degradation in their performance, I need to give them at least 48 hours, 72 hours? I have a lot of conversations, particularly with sprint coaches, that I think are very heavily influenced by people like Charlie Francis. And they have this idea of this immutable central nervous system fatigue, which is extremely hard to even define or quantify. I know people are trying to build up, schematics that help them do that, and technology is coming on board to try and measure some of these things. But even that seems extremely variable between different people. With how much, say, high intensity training they can do or tolerate, or even in a competition, can they do back-to-back days, and who does well when it's a 3 or 4 day competition versus people who are really good on a one-off day competition. And I always make these questions to people and no one seems to answer them for me. I'm like, are these immutable laws that we just have to respect and it's just always going to be the way? Or can you take, say, a younger athlete and say, okay, if it's possible, can I develop them to the point where they can do 5 or 6 days of almost maximal intensity training because we've done it over a long enough period of time?
Well, I mean, the short answer is I don't know, right? It's maybe. Um, I guess there's, when we talk about load and capacity, the simple way of looking at it is, well, we're loading a tissue greater than the current capacity of that tissue, or we're loading a system greater than the current capacity of that system. But the challenge with all of this is all of these background factors. Now, some of those background factors we know are there, but how they influence adaptation and how they influence injury risk and how they allow us to develop essentially what you're calling the unbreakable athlete, they're going to change. They're not like these fixed factors, right? So, and some of these factors are psychosocial, and they're not fixed. They change from day to day. If you're feeling more stressed today, then essentially what you're doing is laying a physiological training stress on the base of a very high underlaying stress, right? But if you're not feeling stressed, you're feeling nice and relaxed, you're ready to receive load, then on those days you might be able to handle a much greater training stress. So we're not actually, when we talk about periodization, the concept of periodization and thinking about tissue recovery and system recovery, it's a good concept, but in terms of how many periodization models that have been validated, it's pretty hard to validate because you've got a lot of these moving parts that change day to day. So some people would say, if and I think this ties into your question. Some people would say, don't worry about periodization as a concept. When you're feeling good, train. When you're not feeling so good, recover. If it takes you 12 hours to recover between sessions, and you've done a high intensity session in the morning and you feel good by the afternoon and you want to do another one, then just do it. If you feel like you can do back to back to back, then just do it. And just listen to your body. Just train relative to what your body says. So there's different approaches you could take. That it'd be nice. It'd be nice to say that you could build an athlete from a very young age, build their ability to handle, repeated high intensity sessions, and it's just a matter of the tissue responding to that stress. All you need though is one change there, right? One change in those moderators, and let's say it is injury. As soon as you bring in injury, then that changes the ability of that tissue to handle stress. Then, not only for that moment in time, but potentially for a longer period of time. One injury potentially predicts what happens down the track. It's a good question. Maybe some researchers will answer it for you.
Yeah, I thought it's obviously something that's almost impossible for you to answer, but I thought maybe with some of your experience you would have some insights or potentially a story of people you've worked with, because the thing that I always tend to come back to is obviously, as you said, the moderators tend to get in the way where something will change. And even if you're starting to approach some of these factors at a point where you're like, okay, they have really good capacities and they're at a really high level and they're clearly tolerating, say, the competition stress, they start getting older. And then that obviously changes the whole equation as well, because their ability to recover seems to go down with that as well. So I think we put it into the questions. I actually came across a short documentary, and how true it is, I don't know, but it was across actually on YouTube, looking at someone like Carsten Wahlholm, and the training volume and intensities that he seems to be doing are really, really high. And there's a discussion about he's starting his career, his coach was getting him to do 20 hours of total training, and now it's all the way up to 40 hours of total training. And that's obviously broken up into, he'll do a training session in the morning, then he might have lunch, and then he'll do, another session and then have a break. But he's actually spending 8 hours in his training venue doing, a reasonable amount of training through that time. And externally, and obviously this is just me thinking about this, but externally it looks like, okay, here's a guy who the coach has been extremely meticulous in how they've applied this to one individual. And they've been able to develop a number of features. And straight away, having thought about the fact that you were coming on, made me think about the paper that you did that was more talking, and it was more of a theoretical paper, but talking about the difference, the floor, the basement, and the ceiling, and whether there actually is a ceiling, or is that something that you can continuously shift? Because in a weird way, and this will sound odd to say, is it something that you actually need to talk to the athletes about, of you actually have no real limitation on how far you can improve, other than potentially where you start and how much time we've got before some of these moderators kick in? And that in itself may potentially, in a positive psychological way, change the approach of the athlete to think, oh, actually, there is no limitation on me getting better here other than my application to this, as long as you're systematic about it.
Yeah, I'm a bit of a glass half full kind of person. So I would like to think that in terms of capacity, most athletes that we work with are not even scratching the surface of how good they could be. And a big
And that's the thought that I have, is we don't reach them. We don't get anywhere near them sometimes.
Yeah, look, and I think some how hard they're training, but really, they've got so much more in them. They just don't realise it, and it's not as though I actually think it's probably freeing up the brain that's going to allow them to get to that point. So, but in terms of and when we talk about a ceiling, I talk about creating a new ceiling. That the ceiling, some people have different ideas around what the ceiling looks like. Is it the demands of what you're required to do? Is it competition demands? Well, I don't want to prepare my players for those demands. I want to step above that and basically dictate to the opposition, look, you play down there, that's fine with us. We're going to be playing 10 or 20% above you, and we're going to strangle the life out of you. And when we've got our foot on your throat, we're not going to let you up. That's the mindset I'm trying to create with my players and my team. Now, I'm also realistic enough that if you're talking about that athlete who's training 40 hours a week, and you're sort of saying, well, is there actually a real ceiling? I think there probably is. If I take my glass half full hat off and say, well, is there a ceiling? Yeah, probably everyone has a hard ceiling. And let's think about it. He's doing 40 hours a week. He's not training 24 hours a day, 7 days a week. All right. So that if he wasn't sleeping and all he was doing was training, that's his hard ceiling. He can't fit any more volume in than that. But let's say if he's doing 40 hours a week and he's thinking, geez, I'm doing a lot of sessions here. How do I improve capacity now? Like I'm training as much as I possibly can. I can't get any more minutes in. This guy still wants to improve capacity. He still wants to squeeze that little bit of extra capacity out of himself. If he can't front end it with load, then he's got to back end it through health. He's got to optimize all of the health. He's got to pull the health levers and optimize that part of his capacity. So he's got to get the most out of his sleep. He's got to eat well. He's got to hydrate well. He's got to practice his mindfulness. He's got to get his mobility in. He's got to keep his stress levels low. So you can either front end capacity through loading more, but when you're at the ceiling and you can't squeeze an extra minute of training in, then the only way you can improve capacity then is through back ending it through maximizing those health factors.
Do you see, in terms of your planning, and this is probably returning to some of the things we spoke about before, that you're trying to expand on the number of, and I don't know if you have a ratio that you kind of develop of how many of, say, competition specific or the amount of competition specific volume that you are trying to get in over a period of time. Obviously, that may vary from person to person, but obviously, say if it's a rugby match, it's an 80-minute game. Are you, as someone who works in that in the sports preparation side of things, saying we need to get in, 120 minutes, 200 minutes, whatever it is? I haven't worked in professional rugby, so I'm not sure what the metric would be exactly. But are you looking at something like that and saying, okay, over the course of someone's career or over the course of the development of this team, we need to get them to this many minutes of really high intensity so that they are, as you said, that 20% better than the other team or whatever it is?
Yeah, well, I mean, if we use rugby league as an example, we know that the ball's in play for, say, 57 minutes of an 80-minute game, and in any game, it could be in play for 6 minutes, where you're going back and forth with no stoppages. So, I want to make sure that my players are prepared for that or above those demands. The worst or the longest I've seen is 11 minutes, where it's just going back and forth, back and forth. But that's one game. It doesn't happen like that all the time. If you can stay in the grind for 6 minutes in that arm wrestle component of the game, and be competing on every play, then it puts you in a much better position for something good to happen at the end of that 6 minutes. Now, there's a whole heap of ways you can achieve six minutes too. Of course, you could do it as all right. We want to practice being involved in 6 minute blocks, or we want to do it as 3 2s or 6 1s or 12 30s. Whatever it looks like. So there's a whole heap of ways, but I do. The pre-seasons are massive, so we do a lot of, in terms of high intensity work. If I have a player that covers a kilometre of high speed running in a game, like, we will do 4 kilometres in a session quite easily. So, that's, we achieve those quite easily. But when it comes to in season, you can't train as hard as that. So, we're probably looking more at a week of heavier work, nowhere near pre-season intensities, and it's very short, just short doses. They're just maintenance doses. If you can improve capacity in season, you're doing pretty well, because it's very hard when you recover.
Well, that opens up that ineffable question of, is it possible to improve capacities during a season, or is that, are you chasing something that's not possible there?
Well, I think you can improve it in some players. Particularly if you've got some players who have been injured, you could, through the reconditioning process, you can actually develop some qualities that they come back in pretty good shape. But in some of these team sports, let's look at basketball, look at the NBA, or look at some of the collision sports where the players are getting beat up pretty bad. It might take them 3 days, maybe 4 days, just to be feeling good again feeling a little bit normal. So the amount of work that you can get in there, it's very rare that you're going to be building on something that you've worked on for 3 months, and you've got them by the time of the season starts at the end of preseason. They that's probably the fittest point you're going to get them to, without match fitness. And I think it's probably more just maintenance doses than you want to try and, like what I have seen in a lot of places is they just don't do any conditioning. It's almost like, oh, well, preseason's over, so that part of our program, the conditioning part of our program is over. Now it's all football. And that's a terrible way to go, because essentially what you're doing is you've got to this great state for game one, and then it's just this decline for 26 rounds of the season to see, well, how low are we going to end the season? So I think those maintenance doses, you don't need as much to maintain it as to build it in the first place. But it is pretty hard to improve capacity in season.
In terms of then, like obviously you worked, with people like Wayne Bennett. How do you think that he actually, and how did you work with someone like him to develop the features needed to get the best performances going into finals? I know that obviously you had a lot of success there. What was part of that? Was that to do with some of the physical conditioning things, or do you think that that's much more to do with the way in which the coaches work to, maximize on skill sets and tactical play and the technical things that are going on in games?
Look, Wayne's a different coach from a lot of other coaches that I've worked with, in that he'll tell you that himself. When I started working with him, he said, "I'm a different coach, but I'm a coach with a difference." He likes to be different from the others, and the players enjoy playing for him because he is different. I would say. In that particular era, they weren't the fittest team. So the fitness was not going to win us games, but it certainly was not going to be the deciding factor in us losing games. We were there were other things that Wayne brought to the program that were as Wayne, he brought a program together that was. I would say technically, he is not the strongest technical coach that I work with, and this is not a criticism of him at all. I actually think what he does exceptionally well is everyone knows their job. He doesn't overcomplicate a simple game. He understands the simplicity of the people he's working with. I'd been in video review meetings that have been highly technical, and then I've been in video review and preview meetings with Wayne, and walking out of there knowing that everyone in that room, every one of the players, every one of the staff knew exactly what their job was, and we weren't going to let the team down. So he's got a great ability to do that. And I think one of the, a lot of people talk about his man management. That to me is his greatest strength, is that he gets around to individual players. Like there'll be a team goal or some things that he'd like us to achieve as a team, but he gets around to individual people and just talks to them one-on-one. He knows how to, just a couple of words to give them a bit of confidence. Some little things he wants them to work on, or some things that he wants them to look at in their game. And people know that, all right, well, Wayne cares about how I'm going. He's looking at what I'm doing. He's given me a job to do. I know what I've got to do. I'm going to do it. So he's, to me, he is a very, very unique coach in that way. There's a handful of coaches that I enjoy working with, and he's definitely one.
Do you see that is in itself a modifier to some of these effects of, the competition and training load? And if so, as a professional working in that sports performance or injury realm, do you think you can influence it by understanding that?
Well, yeah, sure. I mean, let's. One of the things he does well is he creates a pretty happy environment, right? He realizes that there's a job to do and there's a serious component to what we do, and he loves winning. Like, he's a very competitive person. You'd go a long way to find a person who loves winning as much as he does. He loves it. But he also appreciates the fun component. Like that in those environments, they're not like your average environment. They're not like a government job, or they're not like a typical business job. They're a different world, right? And you have some very unique characters. They've got some great sense of humour. Some of the jokes that get told would not fly in outside of those environments. Some of the stories, but he's as into that part of the team as the actual winning and the X's and the O's. Like when we go onto a game and we're on a bus, he's up the back of the bus. He's in the back seat in the middle, and they're all sharing stories with Wayne, like and jokes with Wayne. He loves that part of it. Now, the reason I sort of say this is because if you hear about when people are happy, they perform a lot better, and it's in any
Yeah.
life. When you're miserable, you don't train as well as you'd like. When you're stressed and you've got this massive sympathetic activity that's going on, you don't get the adaptations you want. That's part of the reason behind using HRV and trying to minimise or turn off the sympathetic system to get the adaptation at different times, to get that adaptation. So, in some respects, I think he probably is a modifier in that respect. If you have a coach who creates a really stressful environment, an unhappy environment, then you're probably not going to get the adaptations you want. We know that psychological stress contributes to injuries, so maybe your injury rates go up. You're probably not going to perform as well. But if you create an environment where people want to come and work hard, they want to get better, but it's a happy place to come, I think you're probably going to get a better result.
Is that something that you've ever tried to in any way influence? And is it something that is discussed in those performance environments? Like, I know now you do a lot more consulting. If you go into a team and you're like, actually, everyone's just way too serious in here, and I think this is actually dragging down the approach. Are you saying things like that? Because
Or even are people even actually open to that kind of commentary? Because or are they very much like, come on, we're here because we want you to be objective and give us the numbers and be very
Well, look,
have hard data.
yeah, like it varies from place to place, but and there's no reason I can't do both in the same place. So I'm thinking back to a team I was working with quite a while ago now, but a big part of getting the trust of that group was knowing the standards, knowing what I was expecting of the group, and making that very clear, but then celebrating it with the group when they achieve those standards, and doing some things that geez, that's not a normal staff member kind of thing to do. Like that's, and you've got to understand your group a little bit as well, and who you're working with. So if I'm working with a track and field athlete, or someone who's highly focused, a swimmer for example, and they're very focused on skin folds and whatever, the approach I take with them is different from, or a triathlete is different from, say, a rugby player or an American football player or a baseball player, because I've got to understand the sport. I've got to understand the people I'm working with. Yes, there's going to be objective data from time to time, but other times it's going to be, more often than not, it's going to be understanding the people and trying to work out what makes each of them tick. And that's the challenge. That's what separates, the people who think they can coach from the people who can coach. Like the people who use numbers solely. Look at it can help, but it only gets you so far. For me, in order to get the best out of my players, I have to try and work out individually, what works for him is not going to work for him. Okay, how do I get this guy on side? How do I get him doing stuff that he previously thought he couldn't do, or he previously didn't want to do or couldn't do? And once you've got them, once you show that you care about them as people, it just goes so far. Makes such a difference.
Tim, we won't hold you up too much longer, but is there something that you're working on at the moment in your professional practice that you're finding interesting, and it's sort of either stemming towards more research questions, or even just evolving your practice that's kind of taking something of your interest, and you're kind of quite enamored with at the moment?
Look, I think we touched on the dose response, the load response for different tissues and systems, and that's something that's been percolating for about 8 years, and I finally got those thoughts down on paper. And the different people I've spoken to about that, who work in the rehab space, they're going, oh yeah, this is actually making me think about training load a little bit differently. It's about kind of acknowledging that you can be optimally loading one tissue or system and suboptimally loading another at the same time. And once we get to accept that, I think a lot of people go, oh, it's going to change my practice, but it's also going to take a lot of stress out of the situation as well. That some people have said, I've realised now that I wasn't getting the outcomes I wanted in rehab because I was optimally loading the wrong tissues, and I was suboptimally loading the wrong tissues as well. So rather than targeting the limiting factor, the rate limiting tissue, I was kind of training around it too much. So that's kind of got me going. On a personal level, I like to practice what I preach. So everywhere I go, anywhere in the world, I'll do a half marathon in that location, and it's not like a competition, but it'll be just a little thing. I'll step off a plane and I'll land in Budapest, and all right, I know for 2 hours I'm going to be going to see this city. This is my way of exploring the city. I'll take a few photos. No race, but I'm going to clock up a limited edition Strava entry in Budapest or LA or wherever.
Yeah, very cool. As I said, we won't take you out too much longer, but thank you so much for sharing your knowledge and being willing to talk to us about some of the areas that you have developed your understanding across a very extensive career. I'm sure we could have spoken for many hours, given I think we just scratched the surface, but thank you very much, Tim, for taking the time out of your day.
Look, this has got to be one of the best podcasts I've done. I think the questions were really good. They weren't set in stone. You changed them on the fly.
No,
based on where it was, and the questions were really good. So
we appreciate that.
Yeah, very much so.
If you want to make sure the podcast information is up to date as possible, that's the way you got to do it, right? So I appreciate the fact that you made me think a little bit too today. So that was good.
No, I'm glad. We might have to get you back on because I feel like we only scratched the surface. So as you said, thank you so much, Tim.
Yeah, maybe next time we can talk about my next book, A Series of Bad Decisions, the Tim Gabbett story. That would be a good title for your next podcast.
Is it actually the title of the book?
Well, it could be an uplifting book. You could say, gee.
To be honest, I want to read it with that title.
Tim Gabbett mistakes in his career. It makes me feel a lot better about myself.
Oh, thank you very much, Tim.
All right, guys, have a good day.